Hey guys, this is Cory Hunt here. Today is April 7th of 2022. This is my third log in what I am calling my health diary, and uh, I'm here to document my experience with going through what I believe to be uh, what will soon be my diagnosis for inflammatory breast cancer. Um, I'm 31 years old. I'm obviously a male. Um, and it's not something that is really, it's very uncommon amongst men, but I think I'm definitely going through it because I'm experiencing symptoms that are pretty dead on to what most people experience with inflammatory breast cancer. So, of course, I don't want to have inflammatory breast cancer. I don't want to have cancer at all. But at the same time, with cancer, you need to be diagnosed as soon as possible, hopefully in the earlier stages, and you need to start treatment as soon as possible so you could have the best outcome, the best prognosis. So, although I don't want to have it, I do want to figure out exactly what's going on. And if it is, in fact, that, I'm eager to find out so I can start my treatment. Um, just a quick recap. Um, on Tuesday, April 5th of 2022, I saw my new primary physician for the first time. His name was Dr. Andrew Panda. It took me about a month to get in to see him. I believe I made my appointment sometime. I first noticed my armpit and the right side of my right breast about February 19th or February 20th. By February 23rd, I went into the hospital. All they did was an ultrasound, and they confirmed, or they agreed that my lymph node was enlarged. It was 2.1 centimeters at that time, but that was all they did, and they sent me home. Um, I had to get insurance and so forth because actually at that time I did not have insurance, which is a really scary thing to um, basically think that you have cancer and not have insurance. But by the time I got insurance, I called the doctor's office. I made an appointment, and it took about a month for me to get in. Which really kind of sucks. When you're going through something like this, especially inflammatory breast cancer, because it's supposed to be a aggressive and rapid growing one. You want everything to be like, and that's the crazy thing is like you it's like I feel like they can prioritize you and they can get you in quicker than what they usually would, and I think that would be justified considering the circumstances. Like if they wanted to, they can get me in, they can get me biopsies and imaging tests, and we could probably find out exactly what I have within like a month, or I'm sorry, within like a week period, within a 5 to 7 day period, if not a little bit sooner. But everything is just money now. It's just, whoa, 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 whoa. Yeah, we have the tools to treat you, but who's going to pay us, which is horrific when you think about it. Like this is somebody's life. I'm, again, a 31-year-old young man. I have a significant other that I'm practically married to. We have two beautiful daughters, a 6 and a 7-year-old, who still, not only do my children, but their mom, they all depend on me. They all depend on me. I was the one who, worked and paid most of the bills, and you know, they need my protection, and it's like I have all of these responsibilities to live for, and it's just like, I don't know, man, you just kind of feel like at a certain point society, and specifically doctors' offices and stuff like that, it's not necessarily that they care about your health. They more so care about, well, who's going to pay us? Who's going to pay for this imaging? Who's going to pay for me to do this biopsy on you? Who's going to pay for this? So it's fucked up, man. And like I said, I feel like I should have been seen a lot sooner than what I had. But nonetheless, on April 5th, 2022, on Tuesday, I saw my new physician for the first time, Dr. Andrew Panda. He was a nice guy. Um, um, I had prior to me seeing him, I went into urgent care where I saw a practitioner named Amber Hill. Um, Basically, she tried to feel for masses. She didn't feel any masses, so she started to think, "Oh, this is probably just an infection," and that's the not the crazy thing, but that's the unfortunate thing about inflammatory breast cancer. A lot of doctors can either mistake it or for an infection, or I think the doctors want it to be an infection as well. Like I don't think doctors particularly like telling somebody like, "Oh man, yeah, dude, this isn't looking good. This is looking like it's gonna be cancer," because, just that word and that reality, it just shocks people and it breaks people down. And I understand they don't want to be the one to break the news to somebody, but at the same time, you know, and of course you don't want to scare anybody for any reason. But yeah, that's the unfortunate part about inflammatory breast cancer. It doesn't present as a mass because I guess regular cancer grows as a mass, like a solid, um, large, again, mass, tumor. But inflammatory breast cancer grows, it does eventually form as a mass, but it grows in layers, like that lay on top of each other, as opposed to a solid, ball or whatnot. So it's harder for people to recognize, like, oh, this could be that. um but I saw her within that time before me seeing the doctor, and she prescribed me Augmentin because again she thought it might be an infection. I took Augmentin 875 for about 10 days and nothing happened, man. So that wasn't a good sign. But when I went in to see Dr. Panda, again, I'm sorry, I don't mean to keep digressing. I'm trying to keep everything straight but be as informative as I can. Um, he agreed that due to the fact that I've already taken antibiotics and just based off of the swelling that was going on the side of my right breast as well as underneath my armpit, and just the fact that my skin at the moment looks normal. I know that with inflammatory breast cancer, most of the time women who go and get diagnosed with it, they present with their entire breast is usually red and swollen and things like that. But I am actually not at that point yet. Um, I do have swelling going on, which is probably some of the edema. I'm not perspirating underneath my like majority of my armpit. And those are probably signs of it and so forth. But yeah, I'm not at that point yet. So I'm hoping I'm still in the earlier stages. Of course, I'd love to be in stage 1, but more than likely I might be in stage 2 at the moment if I'm lucky. But again, this is a rapid growing form of cancer, man. And to be honest with you guys, you know what? Let me not digress. So I see the doctor. He was straightforward with me. He said, "Yeah, man, I don't think that this is an infection, but this is beyond the scope of my expertise. So what I'm just going to go ahead and do is I'm just going to send you to a breast specialist." Um, Again, I'm located in Wichita Falls, Texas. It's a small city, so hopefully this breast specialist has seen it before, knows how to treat it. I I'm about 2 hours away from Fort Worth and Dallas, where I know for a fact there are facilities down there that are familiar with it and have treated it and treated, I'm sure one or two or maybe a few other successfully, as in like they are in NED at the moment, or just successfully thriving with it. But I don't know if I have the reliable vehicle to drive 2 hours there and back on a consistent basis for all of my treatments. So hopefully I could stay down here and get my treatment. I forget what the breast specialist name is. Once I look at the paper, I'll let you guys know what her name is. But he referred me to her. Now, he said she's the one who does the biopsies. He said she even performed some of the surgeries and so forth. So I'm not quite entirely, again, I'm not sure if I'm going to be getting my treatment down here, but I'm sure most certainly she would probably be the one to conduct my biopsy, probably even order my MRI and my PET scan to also see it and hopefully see what stage I'm at if unfortunately I do have it. Um, so that's kind of a quick recap on everything that's happened. I did not make a video yesterday for April 6th. Just because honestly, man, I couldn't get to making a video, you know. It was a rough day yesterday, and yeah, I just didn't make it to making a video. So but I'm gonna try to do them as frequently as I can. I will try to do them every day, so that way I can just kind of let you guys know what's going on and how I feel. You know, this could be from my friends and my family, and you know, I would just like to keep track of my progress, as well as and the process, as well as, again, I'm making these videos to bring awareness to inflammatory breast cancer, regardless if I do or do not have it, because this is a very scary disease. Um, and then I want to educate people. You know, whatever I learn about it, I will inform you guys about it. And then you know, if someone is concerned that they may have it, watching my videos and me talking about my symptoms and the process I'm going through might help them as well. Speaking of, let's talk about my symptoms. So again, one thing I've noticed, guys, is my symptoms change daily. They change daily, which is kind of scary, because again, this is supposed to be a rapid growing form of it. So it just kind of seems like everything is just happening so fast. And I'm like, whoa, man, like, give me a chance here, you know? But so again, the symptoms that I'm kind of presenting with so far is I have swelling going on the very top right side of my breast. It's kind of connected to my underarm, my armpit. And I have I'm not perspirating in that area where it's swollen, and perspirating means I'm not sweating in that area. I'm sweating above it, underneath the armpit, but majority of the armpit is not sweating. I feel sometimes these sensations, they come and go, but sometimes I feel a burning sensation, an itching sensation, sometimes even an aching sensation. The aching sensation, most of the time, I do feel are my lymph nodes reacting to what's going on. It's like I could feel them pulsating and becoming inflamed and so forth. But one thing I do notice is that I feel like the sensations, the burning, the itching, and the aching sometimes, I feel like they are becoming a little bit more widespread each and every day. I feel like it's growing away from that area. That's what it feels like. Of course, I don't know exactly what's going on in there, but that's what it seems like. Plus, I kind of notice when I examine my my breasts in the mirror, I kind of notice along with the swelling that there's like a dip, you know, that kind of separates the swelling from the regular tissue, right? And I kind of feel like that dip keeps slowly getting closer and closer to my areola or my nipple. And which again kind of makes me feel like, okay, does that mean that it's becoming more widespread? And if so, like, God, dude, this is happening quickly. And I notice I'm having the sensations of the feeling sensations. I get them almost every time after I eat a meal. Now, and that's scary. It's scary, man. It makes you feel like you don't want to eat, because you're like, if I eat, I'm making this worse, you know? Unless you probably do a vegan diet and you're juicing and stuff, which I did buy a juicer, but I will tell you guys right now, it is very difficult to basically go cold turkey from always eating meat and dairy and cheese and just sweets and whatever you want, to going to where you're essentially just eating rice and vegetables, you know, and maybe beans. And it's very difficult, man. I did it for about a 2-week to 3-week process, a 3 time period. And it was, some days it was easy because I was so depressed I didn't have an appetite anyway. So it really wasn't difficult for me. But you know, once you kind of, I guess you could say, gain a little bit of hope and you become more optimistic, your mood gets better, you start to get your appetite back, you kind of want to eat what you want to eat, and then at that point the diet becomes very difficult, so yeah, it's difficult, man. So but I do need to get back on this diet. uh yeah, so that's what's going on with my symptoms, man. They're not quite as bad as what other women usually present with when they finally get diagnosed. And again, their diagnoses are usually at stage 3 and stage 4 because it just doesn't get caught until later. But again, I'm hoping that I'm still at the very least in stage 2, because again, the earlier you catch things, the better chance you have of beating it. So um what else is going on? Yeah, man, just I have moments of hope and then I have moments of despair. It's a roller coaster of emotions, man. And like I said, I kind of feel a little like, you know, how do I put it? I just kind of, the moments where I feel despair and defeated is usually when I think about my situation, like in a sense of like where I'm at. Again, I'm in a small city. I'm a couple hours away from the big city. It'd be different if I was only like 30 or 45 minutes from the big city. Like, I'm pretty sure my car can handle that. Hell, even if my car couldn't handle that, I could probably fucking ride a bike, you know, a 30-minute drive. It might, I might, at that point, it might be an hour bike ride or an hour and 20-minute bike ride. But hey, I might be willing to do that if I can get back and forth to my treatments and stuff. But 2 hours, man, it's just, there's no way. I mean, a 2 hour bike ride would probably turn into a fucking 4 to 6 hour bike ride, if not longer. It's very far. I don't have a super reliable vehicle, and I just don't know if they're going to have all the tools needed to properly treat me out here in this city of Wichita Falls. So, um, other than that, one thing I kind of feel a little bit of relief in momentarily. It kind of takes my mind off of things. Is I play Call of Duty from time to time. You get on there, you get to interact with other people and focus on a goal, and it kind of takes my mind off of it for a little bit. But as soon as the match is over, it's just like you just get sucked right back into that mindset, and then you get depressed again and stuff. And another thing that depresses me is I just feel like I can't happily interact with my children. Like, I'm just so sad and depressed that, of course, when I see them, hi baby, what you doing? Oh, okay. Um, all right. I'll end the video here. I got my wife calling. Um, and yeah, I'll keep you guys updated. I'll make another video here shortly.